Hello, I am so excited to bring you something new that is the Women's Health series that I'll be airing here on the podcast over the next couple of weeks. I know this podcast and normally what I coach on is all on nutrition and lifting weights for ladies who want to build muscle and decrease body fat and really look the part and feel the part. But there's so much that goes into that. I know we also talk about blood work and a lot of coaching and systemizing your life, not only on the podcast, but in my program, Create Your Shape, where I work with all of my ladies. However, I want to take this time to expand on all of that and bring in experts from pelvic floor health to astrology and herbs and HRT, infertility, and running $1 million business. So I'm excited to share these conversations I've had with all of these different ladies. They have been so valuable and really discussed through the lens of wanting to be that fit, strong, healthy female who has it all in all aspects of her life. And I know for many of you, that is what we're all after. So let's get into it. Hello, friends. Today I have a special guest for you, Lauren. I'm not even going to try to say her last name. I'll have her introduce herself, but she is a pelvic health specialist. And so we're going to get in. I feel like it's a very hot topic now, as I've mentioned to her, even though she's been doing this for 12 years. But I'm getting a lot of questions about pelvic health. I'm curious about it. I think we've heard it in the form of definitely pregnancy and postpartum, but I've come to learn it is way more than that. And she's going to tell us all about it, tell us what she typically sees, and just educate us on all of it. But first, I have to try to remember how we know each other, because I always like to share like the connection with the guests I have on. And I mean, I've been following you for years. I know you were in Create Your Shape. We both know Jamie, who is also a Create Your Shape superstar and has worked with you. But how did we get to this point?
I don't know. Jamie will totally know. We should like three-way her in or something. I can't remember if like Jamie worked with you first and then I found you through her. I'm kind of getting those vibes. I don't remember, or vice versa. And I just like found you in the Instagram interwebs, and I don't know, but
that's what I thought
I'm
it
happy.
was. But now I was like, no, I think you referred Jamie to me. But you know what, Jamie, we know you're listening. You can tell, and we will figure it out.
You
So
100% will know. Oh man.
So that just shows you the beautiful like interwebs. And my Lauren's located in San Diego, where I used to live, and she has a practice there. So if you're in San Diego, definitely you can check her out there. But she also shares so much online. And I think that's like the beautiful thing of having an online presence and having virtual options. But can you introduce yourself? Who are you? What do you do? Give us all the goods.
Yes, I totally can. And when you said San Diego, I think we met at a networking event, like a women's entrepreneur networking thing. What was it called?
It's now called Levels. It was called something else, but we can remember it. Yes, yes, Dames Collective. That's what it was. Okay, you got it. Amazing.
Oh my gosh. Okay.
So who are you?
So there it is. Hi, I'm Lauren. My last name is Mallari-Snyder. I hyphenated because, why not? And yes, I'm a pelvic health or pelvic floor physical therapist. I have been doing it for 12 years, which seems wild because it's been my whole physical therapy career, except for like the first 3 months of it. So I've been in the pelvic floor world for that long. I've had my private practice for like 6 years with my husband, where we treat clients in our office, and they just come directly to us. We don't work like within a hospital or anything like that. So it's really amazing. We don't work with insurance. That's another thing. Anyway, so yeah, I got into this, like I said, only like 3 months into being a physical therapist, because a couple of things. I think I'm an oversharer, so people are like comfortable to share things with me, which is fantastic. That's like my most favorite thing, is that people feel comfortable with me. And so I would hear about like, oh, I pee my pants, when I sneeze or cough, or sex hurts, or, I just had a baby and it's wonderful and I'm leaking, but that's okay. Like, that's just what comes with its territory. And I was just like, what? Like, I didn't have a baby at that point. Right now, I have a 1-year-old. So I did 11 years of this without actually, being a mom myself. And so I was just like, that doesn't sound cool. And then secondly, I was like, working with them, working with people with back pain or hip pain or whatever. And you all know your core is very important. Turning on your core, engaging your core muscles, your pelvic floor is part of your core. And a lot of people couldn't access that. And then when I'd go to talk about it, they'd either get like kind of squeamish, squirmish, and like embarrassed. And then we talk about it more. And so I was just like putting all the pieces together, and then also putting the pieces together of like, especially for the people who have had babies. So like, we'll get more into this, I'm sure, about like what the heck is the pelvic floor of the anatomy, just as I'm talking about it already. It's the muscles inside of your pelvis. So anything that has to do with pee, poop, or sex. But again, we'll go more into this. Um, I was just like pissed because like a lot of the people who were moms and they birth babies, I'm like, thank you for your service. You're keeping our like human human race going. But then also we have nothing to help you, or not enough to help you. You're like at a deficit trying to heal from this, but you're also expected to go back to work, carry this awkward ass like car seat, expected to just like quote unquote bounce back to your
Mm-hmm.
pre-baby body, which is just bullshit. And like then okay, you want to go out for a fun night with your girlfriends because you just had a stressful day with the baby, and then you're gonna laugh and you're gonna pee your pants. Or you like want to have like a nice night, maybe you have a little sex. Ouch, it hurts. I was like, no, there's like it was just a lot of like downers. And I was just like pissed. So 3 months of that, and I was like, okay, we gotta do something about it. Here we go. So that's the long and short of how I got here, because people often ask, not anymore because now I have a baby, but like, why, how do you get into pelvic floor physical therapy when you don't really
Yeah.
seem to be like having to worry about your pelvic floor? And I think we'll talk about this a lot today. Like, yes, I work with people who are pregnant and postpartum primarily because I'm also into like the birth world, birthy side of things, but everybody has a pelvic floor.
Mm-hmm.
And it's important for everyone, whether you're pregnant or postpartum or not even thinking about getting pregnant, male or female, whatever. Like it is very important, and it's it's like another um another core slash another diaphragm, because you want it to move well like a diaphragm. Anyway, I'm getting too excited and like talking about too much, but
Well, let's kind of build off that because it is
yeah.
important. And we did an Instagram live together the other day, which took me from like zero knowing nothing to like, okay, I understand the importance of this. But let's just kind of recap and start from the
Back it
beginning.
up.
And we'll go to the details. If you guys listening already know this, we'll go to the details. But let's just start with the beginning. Like, what is the pelvic floor?
Mhm.
And if somebody like wanted to like think about it, like I like how you described it of like I think you said pee, poop, sex, and like thinking of those muscles and squeezing those muscles, is that like activating the
Yeah.
pelvic floor? So can
Yeah.
break it down for us.
Yeah, absolutely. Okay. So if you're sitting down right now, your pelvic floor muscles are what you're sitting on. Part of what you're sitting on are in. They're the muscles that live inside of your pelvic bowl. You're the bones that make up your pelvis, right? So like you have your like sacrum in the back, that big bone at the end of your spine.
Mm-hmm.
And then you have your pelvis, where you're like, if you put your hands on your hips, not dip you dip we dip, that like that's actually your pelvis. It's not your hips, but whatever. That's your pelvis, and the front of your pelvis is your pubic bone.
Okay.
It like makes kind of like a bowl, right? And then you got like your tailbone under there. Everything inside of that, it creates like a little bowl of muscles on the bottom. And those muscles are your pelvic floor muscles. I think it should be called pelvic bowl muscles, but whatever. Inside of your pelvis
Mm-hmm.
holds your organs, right? So for like you and I, we've got our bladder, we've got our uterus, you've got your fallopian tubes, your ovaries, all that. You got your rectum on the backside, the colon, and all of that. Then you have all of your intestines even higher above, but everything kind of sits in that bowl. So pee, bladder, poop, colon, rectum, anus, and then sex, vagina, if we're talking about like you and I right now, but men have pelvic floors too.
Mhm.
So anything that has to do with that. So if you have heard of Kegels, or if you could think about like, stopping your flow of urine, your like stream of urine, those muscles that you're engaging are your pelvic floor muscles. There are multiple layers of your pelvic floor, so I'll just talk about two of them. When you're doing said Kegel, which AKA I like to call them in our office, we call them push-ups
Love it.
because it just makes sense, right?
It does.
So you would like with the couple of the layers, you would like close the vaginal hole, the vaginal opening, and then like lift up, like you're pulling up like a tampon up the vagina or something like that. That gets like two different layers of the pelvic floor going. If you are a person that has a penis and a scrotum right now listening, you would be like lifting the scrotum. Like you're walking into cold water and you're like, I mean, it would go up on its own, but still, if you wanted to help it go up, that would be it. So the pelvic bowl or those muscles, they need to be mobile. And so I think like something at least that I've heard all growing up is like you got to have a tight pussy. Like
Hmm.
that's the thing, right? There's even like there was something called a husband stitch that some people would get
Oh my gosh.
with or without consent after like having a baby. And it's just that it's just like not true. And you know this as well for the other muscles in your body, like a tight muscle is usually a weak muscle. It's like rendered weak because it can't freaking do anything. It's just like tight. A
Yeah.
mobile muscle can do more, right? It can move through a bigger range of motion. You can get more out of that muscle. You can get more out of that thing, whatever you're trying to do. So the pelvic floor is just like that. So we want to be able to contract it with that push up. We want to be able to relax it. And you also want to be able to stretch and lengthen it. And we can talk about that more, but
So,
I'll
okay,
stop.
that's super helpful. And just to kind of visualize where it is, how it works, what it like naturally does. So
Mhm.
then I imagine like most muscles, right? Generally, they develop fine and everything's great. But then either because of a certain situation or because of some reason that
Mhm.
they develop an issue where they're not working as well as we'd like them to.
Yep.
Is that what are some things that happen that cause problems for people or and like what is kind of like the root cause that then creates those issues?
Yeah, you're exactly right. Like they are just muscles. They're just muscles. They're just happen to be in a cave. So all the same principles apply. Like for instance, if you're a really tense person,
Mm,
okay, we know about like, shrugging our shoulders, tightening our jaw. There's actually a very big correlation to people who have TMJ, like jaw issues, have tight pelvic floor muscles. Of course, not everyone. Okay, go look up the study. I don't remember the study right now, but that's the thing. Like tight
yeah.
here, tight down there too. And if you have excessively or like overly tight pelvic floor muscles, like I just said previously, they're rendered weak. So say you need to cough, right? Or you need to sneeze. That's bigger. You need to sneeze. And when you sneeze, that's a lot of pressure, right? So your bladder is going to be like, huh, like kind of like bounced around because you're sneezing. But if you have this really, really tight pelvic floor, it can't um like hold that bladder. I wish you could see me. It can't like hold that bladder and like allow it to bounce in within the muscle like a little trampoline. You'd like prefer if you're gonna drop a water balloon, you'd prefer to drop it onto a nice little trampoline
Mhm, mhm.
rather than like a concrete floor. So if you have concrete floor pussy and the
Yeah.
bladder hits it, like, you know, that can cause leaking actually. And
Oh,
now, yeah, let
okay.
me take a step back. Like your
Yeah.
bladder's not actually coming out of you and like hitting the hitting things, and it's just I'm trying to like help get the idea that like that tight pelvic floor is not allowing for any give of motion when you're sneezing or if you're running and you have a tight pelvic floor and everything's just clenched in, right?
Yeah.
That bladder just like, and then you might leak, which most people think you leak because it's all loose and everything. And that's a thing too. But honestly, like most of my population, the pelvic floor muscles are like overly tight, causing,
Ooh. Okay, this is
yeah.
so good because I want to create a few analogies and see if you agree and to kind of drive it home. Because one analogy I have is like for, let's say you have like a tight hamstring, right?
Mhm.
Generally, you know that and like you can feel that throughout everything you do. And
Yeah.
you have that tight hamstring, but you still work out, you still do CrossFit or whatever, and then you more likely get injuries because of that
Mhm.
tight hamstring. But the pelvic floor, I think we've talked about this before, where you've mentioned like it's one, because we just aren't as educated on it, I'm guessing, but also we're not as aware. So we don't know if we have a tight pelvic
Yeah.
floor, but that could be creating to this like this injury. So one, do you agree with that? And then I have one more analogy.
Yes, I do agree with that. I think it's, yeah, it's kind of hard. Like you could stick your finger in your vagina, right? Because that's how you would feel the pelvic floor muscles. That's how we do it here.
Yeah.
Or if you don't want to, then we can do it externally. But then also like, I don't know, how many pelvic floors have you
Yeah, I would
palpated?
have no
You know,
idea
like,
if that was right or not. Okay.
yeah.
And then the other interesting thing where you said like a lot of your population and that you work with females that it's actually tight
Mhm.
and associated with grinding teeth, whereas the population I work with is females who are very high achieving go-getters who don't realize that their standard baseline is higher stress, right? They've just lived that way their whole life. And as someone who has grinded their teeth before, right? Like that's definitely me. And so going back to like this, like you may not even be aware of that and how stress works in your body, but okay, this stress in my side, what I see is higher cortisol levels, which then impact their ability to that impact other hormones and steal from other hormones, but then impact their ability to like build muscle or decrease body fat because of this, like I'm putting in quotations, like invisible issue that they're not aware of. But as we're seeing, it's not just building muscle and decrease body fat, right? That stress then impacts tight pelvic, right? And this happens over time. So I just wanted to kind of draw those two things together because I think a lot of ladies listening are in that category and just kind of to open the ears, be like, oh, actually, this could be me. And even if I don't have, leaky stuff going on right now, like something to just be aware of for going forward.
Yeah. Yeah. And I just use the leaky thing like as one example. Like another issue sometimes that's caused by tight pelvic floor muscles is pain, like pain with intercourse, right? Or mimicked like UTI symptoms, but you don't actually have a UTI, but it feels like one.
Mm,
Um, because
okay.
of the tight pelvic floor muscles. But yes, when we're like in the population that I treat, it's kind of like wide as far as if you think about it just on the like exercise in the exercise world, right? Like I've got some gymnasts, I've got some CrossFitters, I have some people who are runners, and then I have people who don't work out. Okay. But they mostly are all under some load of stress, right? Because you can be this super high achiever, CrossFitter, go, 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 and have your clenched jaw.
Mm-hmm.
And you can also be this person who wants to wishes maybe they could be like moving their body more, but can't because they might be taking care of like four kids right now at one time, and they're like having to manage the household in that way, and that's super, super stressful, but they have to keep their stuff together. So they have to seem under control, and
Yeah.
that's that hidden stress. And like no one can see a tight pelvic floor.
Yeah. Or even
Right.
careers, right? Like ladies who are climbing the ladder and have that internal, like just sucking
Mhm.
everything in to be like on point. And yeah, I can see
Yeah.
that for so many people. Oh, that's such a good thing to call out. So what would do you have any more examples of like issues that you see that come from this kind of underlying stress or like this like
Yeah.
constantly engaging in too tight of a
Constantly.
floor?
Yeah. You just mentioned like sucking everything up or sucking everything in, also like literally, right? We wear like like leggings all day long and stuff, and that's
Yeah.
just also like our culture. That's also a whole other thing. But um yeah, I'm like, what else? So, have you heard of, I work with people who have like prolapse. And
Oh.
prolapse is when there's like pressure feeling in the vagina, which might actually be some of the tissues of the vagina or the bladder, like kind of leaning back against the front of the vagina or the rectum, something that's pushing pressure downward. And again, this doesn't have to be just someone who had a baby. This actually happens in heavy lifters.
Mm.
So there's there's a move called the Valsalva that you can use on purpose when you're lifting heavy, right? You inhale and you brace and you push out sometimes against the belt. What am I trying to say?
Yeah.
Like your lifting belt, right? And that increases pressure in the abdomen, like rightfully so, and very helpful for a lot of people who lift heavy. But if you're someone who's wanting to avoid some pelvic floor, I have to say potential, it's not going to affect everyone, but I'm
Mhm.
sure we also have seen videos of people lifting heavy and peeing their pants. And I love that the videos are out there because
Mhm.
it's like, let's normalize it. And I like that. I like showing it and not being so embarrassed about it, but it's not normal. That means that thing is too much for your body to handle. But then again, oh, hey, balloons. Um, that like when I work with my clients who do lift heavy, like I leave it up to you. What's more important to you to get that 400-pound PR
Yeah.
or to like not prolapse or not have this excessive pressure out of your vagina or out of your anus, right? That happens too.
Yep.
So, and that's each to each his own. But if you're trying to think about, you know, maintaining good pelvic health and not having heaviness in the vagina down the line, I would advise against that Valsalva breath, or at least go work with it, work on it with a pelvic health therapist, because then we literally could like put our finger in there and be like, okay, let's see what happens. Because maybe you can do it, because you're supposed to just like like keep everything in. You don't want to bear down, but it's kind of hard not to if you have,
So I have a question on that because that breath is definitely something. I mean, even last week, I was lifting and different people in two different times told me to do that type of breath, which I've never, I've heard about it before, but I've just never felt comfortable with it. I
okay.
typically do the opposite. And I think this is from my like gymnast days where I
Mhm.
kind of more like instead of breathe out, I like breathe like in kind of
In.
like a hollow hold almost
Mhm.
to like feel like strong that way, like my core is like strong, and then I can do whatever lift it is. So
Yeah.
is it where would the kind of the opposite of that breathe out and hold, that is that would that work? Or are you saying like pretty much once you get to a certain point when you're lifting heavy, if you're squeezing that core and putting pressure on it, you're creating that risk regardless?
Um, there are different ways to do it. I
Okay.
think that your biggest risk of putting that pressure down into the vagina or out into the abdomen, because some people have the little like abdominal split, that diastasis recti.
Yep.
Um, that if you are pushing, if you're inhaling that air, blowing up like a balloon and then pushing out or just holding it right there, that is going to put you at more risk to bear down and put pressure down where you may not want it if you if
Yes.
you want to keep your floor happy. If you're doing it your way, like the breathing in, like sucking in your stomach,
Yeah.
that's also it's also well, all we're trying to do is create a stable container,
Mm-hmm.
right? So you're increasing the pressure of your abdomen in some way. So some people are increasing it by putting more air into it and then locking it in there. Some people are increasing it by just making the can smaller or the tube smaller. And
Yep.
so the pressure that's in there now is pressurized because it's smaller. Um, I usually like suggest that way by making the can smaller, but opposite from you, doing it on the exhale
Okay.
because that's how we actually engage the muscles. So like if you were to flex your core muscles right now, just sitting here, you would probably
Yeah.
exhale. If someone's going to punch you, you would exhale. And that's also how our diaphragm works. Um, when we breathe in, it goes down. When we exhale, it goes up, and we can contract our abdominal muscles too. So I don't want to get too far into it, but we're increasing intra-abdominal pressure some way, either by stuffing more air into the can or making the can smaller.
Okay.
And making the
Helpful.
can smaller and exhaling the extra air in the can out of your body, I think is a safer, nicer way to do it for your pelvic floor's health.
Okay. Noted. That's really helpful. So
Good.
let me ask you now, two questions. First, you kind of already established that pelvic health is for everyone, right? That it's
Yes.
something to be aware of and consider, 20s, 30s, pre-pregnancy, postpartum, and 50s beyond. Um, so are there different things that you see in different age groups? Typically, that's kind of the first question I'll ask you.
Um, honestly, mm, I think the biggest no, they're all like it's all fair game.
Yeah.
My first patient was 21 years old. She didn't was never pregnant, like I have a 80 something year old patient, that it's that when you get once people have, hit menopause, there's other factors that we're running into with like the hormone changes, right? That can be the cause of some people's, like, let's say pain with intercourse. It
Mm-hmm.
might be because of the hormone imbalance, but then some people are taking hormones. But that hormone imbalance can also happen during pregnancy or postpartum.
Mm-hmm. Or
So,
just from
so no,
stress that I see,
or just from stress,
or
yeah.
under eating. Yeah. Okay.
And you can have tight pelvic floors in any stage. I mean, we've all, you know, I thought high school was stressful,
Yeah.
college is stressful. And you can also have a tendency to bear down and put pressure down into the vagina, kind of creating more laxity of the muscles rather than too tight,
Mm-hmm.
making them kind of too lax from like bearing down often. If you're stressed, or if your habits are just like, I'm just looking at the water bottle I have right here, like for the machine, like if my habit was that when I pick up that water bottle, I bear down and throw it over my shoulder, because you don't think about that. Who thinks about that? No one thinks about like, oh, am I pushing down in my vagina right now as I put the
Yeah.
water thing in? So it's no, I mean, as we age, we can, lose muscle tone. So that might make it sometimes a little harder to keep up the pelvic floor tone, the muscle, like the actual tone of it. Um, but that doesn't change like your brain's ability to connect to your pelvic floor. You can still work on that and be like, oh, I wasn't contracting that muscle. Now I can. Like the age doesn't change that ability. And instead of age, I just also think about like repetitions. I talk about this with like my runners. I'm like, well, high schoolers can have issues too if they're long distance runners. I'm just talking about like
Yeah.
knee issues or something. It's just like repetitions of the thing that you're doing. Yes, we have more repetitions when we're older, so you could say that's a thing, but
That's a really
um
good way to put it. Okay, that's really helpful. The other
mhm,
thing that I wanted to ask you about, and because we've talked a lot about like pain so far, but you also have brought up before pleasure. And so
mhm.
we weren't able to get into it in the IG live, but we have the time to talk about it now. So I'm curious about what that means in using pelvic floor health for increased pleasure and kind of your thoughts on that.
Yeah. So obviously if you have pain, it's hard to have pleasure, right? Unless you're doing that on purpose. But anyway, so once we pass that and get out of pain, right? If we just let's take pain off the table, and you're someone that, comes in and you're like, oh, I don't have good orgasms anymore, or I don't really feel anything anymore. Well, there's so many things that can be part of it. The nerves that innervate the clitoris and the vulva in general, which if I'm talking, talking about pleasure at the pelvic floor area. Let me just disclaimer here. Pleasure is wherever the heck you want it in your body. It doesn't even have to be on your body. It can be in your brain, whatever. Pleasure is pleasure. You do you. Since I'm a pelvic floor therapist and we're talking about vaginas and vulvas right now, we're going to be talking about genital pleasure. But I think that's a huge thing, because first and foremost, chase the pleasure, not the penetration. Okay. That is not like the gold standard, have to do that. If that is something that you want to do and you're not feeling good orgasms, whether it's from penetration or clitoral stimulation, we need to be looking into the nerves that innervate that area, which come from your sacrum and your lower back, and as they trace through your pelvic floor muscles. And so if your pelvic floor muscles, let's say, are really tight and the nerves are kind of like getting strangled and can't send good information there, or the pelvic floor muscles are really tight and don't allow enough pumping of blood to the vulva and to the clitoris, that's gonna, like, that's a little cock block there. The clitoris is not just a little bean that you see in like drawings or even have seen on yourself or whatever, that has been advertised. It's a much bigger structure that goes inside of your body and actually like straddles the vaginal canal. So in order to have full pleasure, and especially pain-free pleasure, and if we're talking about penetration, we want all of those tissues. The vulva is like, by the way, the vulva is, if you were to take a picture of it, that's what you would see. You can't see the vagina, that's the tube inside. So your vulva includes your labia, both the outer labia and the inner labia. The vulva needs to become engorged with blood, and so does the clitoris. And the clitoris engorges with blood and becomes erect just like a penis does. And if that doesn't happen, let's talk about penetration. If the clitoris that's straddling the vagina, like it's sitting on like a little horsey, if it's straddling the vagina and it's not engorged and something goes into the vagina, that clitoris might not get hit. It might not get bumped into because it's just like not really there. But if it's engorged, sitting on top and around the vaginal canal, and something goes in there, now it's like plumped up and it's like, oh, you can run into me, like hit me or rub by me, and that can be a pleasurable sensation that you didn't even have access to before because it was never even engorged.
Interesting. And so then the connection between engorging it, what's the connection between those pelvic floor muscles in that engorgement?
The tightness, well, both tightness and like laxity. So if the pelvic floor muscles are super, super tight, they can't allow for that like mobility to pump the blood towards it to allow for the engorgement, right? They're just like stuck and tight.
Yeah.
And then on the flip side of that, if the muscles are really lax, they might be moving, they might be like, contracting a little bit, but they're kind of like lazy and not pumping enough blood, or not like squeezing around. If you're having penetration, not squeezing around that area enough to feel it.
Yeah.
And then also for orgasm, our muscles are contracting, right? So like if you have weak muscles, then you're probably going to have a weaker contraction, and that might feel different from what it felt like, some other time in your life. If you have really tight pelvic floor muscles, they're already contracted. So they go to contract with this orgasm, but they're like these little, like little mini ones. And so it's just,
that might be where the pain comes in for her.
It could, it could come with pain. Yeah. Or it can come with just like a weak or a short orgasm.
Yeah.
Like a really dull one. Yeah. Okay. So
this is so interesting. We're all learning so much right now. So
I'm glad.
I have more questions, but you might have more. So I'll let you go first and then I'll ask.
No, it was something about, the engorgement process. So also, I think what we have failed to be taught is that for our female bodies, that clitoris and the vulva takes like 45 minutes to engorge, which I realize we don't all have 45 minutes. I realize, ideally, all right? But You should read, if you anyone should read the book, Come As You Are by Dr. Emily Nagoski. It's amazing. It talks one thing, she talks about a million things. One thing she talks about is that our brain is our biggest sex organ. And
Mm-hmm.
so like this 45 minutes of quote unquote foreplay, we'll call it, can be just like flirting or whatever, right? Because your body is anticipating this and it can get excited. Like think about, when you first started dating Aaron, like you didn't see, oh, I don't really know, but you don't see each other for a long time, I would assume. Like you didn't immediately just start living together,
Yeah.
right? You have like all like Saturday to Saturday, you only see them on Saturday or something. So you have 7 days to like become engorged.
Yeah. Okay.
It's like that's a lot of time. And we're different. Penises don't need 45 minutes to become engorged. Usually, I should say typically. Um, so that's something else to take into consideration because if you're not feeling like you're having full pleasure, like it could be better. Could it be as a simple thing as like, oh, actually, it's because my pelvic floor muscles are really, really tight instead of, oh, I don't like my partner anymore. This sucks. Like it could totally be that, or it could totally be like, you know, 2 minutes is just not cutting it.
Mhm.
It's not engorging the clitoris enough. And like, I think I said this briefly on our Instagram live, like you would never use a flaccid penis because it just doesn't work. If we're
Mm-hmm.
talking about penetration again, you can't stuff a flaccid penis into anything, but a quote unquote flaccid, like, vulva, vagina, clitoris, all of that, like, unfortunately, you can
Yeah.
put something in there. It might not feel good, but it like mechanically can work. It shouldn't work. There should be a gate that like open.
Okay, do not enter.
Yeah.
Okay, this is so interesting and so helpful. So I'm curious now because it sounds like whether like pain or pleasure, there's a lot of the same root causes when we're talking about the pelvic floor specifically of that the muscles being too tight or too loose. So I'm wondering like what is the process that you kind of take people through when they come to see you? um I know you talked about doing a check to even see if things are tight. Is that the
Yeah.
first step? And then from there, what does it look like? Is it certain exercises you give based on your assessment? Like, what is kind of give us a high level of what that looks like?
Yeah, yeah, for sure. So, we yes, look at your pelvic floor, of course, which meaning we can do an external or an internal assessment. So an internal assessment is more accurate. So that would mean like internal vaginal, so a finger in the vagina to
Mhm.
feel for those muscles. So I just feel and literally like, are they really tight? Or when I touch them, do they cause you pain? And then I'm mapping out which muscles those are, where they are, because they all have different names and do different things. And then I also will check your strength. So literally like squeeze my finger and
Mhm.
try to pull it up and grade your strength that way. I personally do it both laying down and standing up usually, because if we have issues, like for instance, with like that heaviness in the vagina, that's more common in standing. And we just change. Or like if I'm working with someone who's lifting a lot, I have my finger in there and be like, okay, go ahead and squat, grab
Yeah.
that weight
Okay.
and assess it like that. In addition to that, because all physical therapists, we're all trained as orthopedic physical therapists first before we go into pelvic health. Um, I'm very curious about what your normal body mechanics are doing because they are impacting your pelvic floor. So something that's really common are like butt tuckers. People that squeeze their butt, they're like tuck their butt under. You can imagine tight butt cheeks, tight butthole. Your butthole is
Mhm.
also your pelvic floor, right? Is right there. So that can contribute to tight pelvic floor muscles. Um, and then I'm assessing all of your other strength, your core strength, your glute strength, your hip strength. Because if any of those are weak, oftentimes your pelvic floor will be like, okay, well, I'll try to help, and then they're trying to squeeze, but they're squeezing too much because the glutes are just on like vacation and like there's an imbalance there. So there's this whole, yes, pelvic floor internal in the room assessment, but there's also an assessment outside where you're walking and squatting and doing whatever movements that you do in your life.
Oh, wait,
And
can I
then,
stop you really quick? Because I have a question that relates to this. And so
yes,
I'm wondering, in general, do you find that like lifting weights in general would be beneficial for the pelvic health unless
yes,
you're doing it incorrectly or too heavy or too extreme that causes these injuries?
yes. Sorry, I got excited, but yes is still my answer. Um,
Okay.
because 100%. Sometimes like just doing a push up, aka a Kegel, is is not enough, or it's to someone who doesn't have that relationship to their pelvic floor anyway, is not going to be able to do that, right? So sometimes I have to like trick people into doing it by doing a sumo squat or something else, right? Like
Yeah.
there's all kinds of little tricky tricks. And there's, carryover. So I 100% think that lifting and lifting heavy, not just body weight, is super helpful so long as you know what the heck you're doing inside of your pelvic floor.
Yeah,
So
okay.
having that assessment is really helpful and doesn't have to take forever, right? It's it could take one visit, right? You could come in, get assessed, and like, cool, you did it right. Or okay, that was backwards. You bared down, instead, and then you're getting homework and we're working on it. Maybe it's a couple visits so you can get the hang of it.
Okay.
And yeah, finding
I
and
had one
maybe
other question too before
yeah.
we go. I know we're still at the assessment, but it's like this is just so good. So it sounds like too, even if like, let's say for me, where I'm like, oh, I don't have any issues, but I'm like a preventative person and I want to make sure
Yeah.
that I'm like thinking ahead, I could come in for a visit just to get assessed to make sure that even now that my muscles are my pelvic health is in a good place. And if not, I can do some things to make it even better to optimize it, even if I don't have symptoms.
100%. Yeah. So you can do the assessment, and then it could even be so specific as, okay, like do the clean, right? Like clean this, and you're good, you're good, you're good. And then we find the weight that is quote unquote too much for you, or the weight that your pelvic floor starts doing weird things, or
Yeah.
right, you're like bearing down. And then I just tell you that, okay, I know you want to lift more. You want to progressively overload, right?
Yeah.
And heads up, at 135, your pelvic floor is doing this thing. Can you change that coordination? Can you change your breath pattern? Okay, let's reassess it. Oh, you can. Cool. Continue. Or, ooh, you're still doing it wrong or, inefficiently. And then you're
Okay.
probably going to stay at 125 and work on it, or maybe less, whatever, and work on it.
So just
And
like any other muscle or progression. And then also you guys, it sounds like you, I mean, you get like individualized and detailed. So you do the assessment and then
Mhm.
based on the assessment, you kind of make a progression plan from that. And then based on people how progress is how much time, how many visits they need or how long they need to like
Mhm.
work on this. Um, okay, that's what I've captured so far, but keep going because I'm
Yeah.
intrigued.
Well, no, that's it. So we do your assessment, we find all the things, and sometimes it's like, no, your pelvic floor is great. You just need to learn how to breathe better.
Okay.
Or, or it is, yeah, a progressive, we need to give you certain exercises, right? And so in physical therapy, we do spend a lot of our time on the manual work and the neuromuscular retraining, that brain to body retraining connection part. And then we also do the reps here, like we have a gym here, but we only have an hour. And so oftentimes I'm talking with personal trainers in the outside world, outside of Thrive Physical Therapy, that's my company, to help continue on with making those programs. But they
Yeah,
have
oh,
to like
so good.
know what the hell they're talking about in pelvic floor world, right? So I love doing that because programming is not my forte,
Yeah.
but assessing your pelvic floor is, and telling, finding the things that your trainer's not going to find in the class that you're taking, or even if you had a personal training session. They're literally not, that's not their job. Like,
Yeah.
like, and we're
Yeah.
right there. So
That's so amazing that you have that expertise, but you're also a lifter yourself. So you understand that world and you understand like these type of ladies holistically beyond just their pelvic floor or just the gym, right? You understand them as like a whole human that has other stressful things going on in their life. So that's amazing. Okay, this is maybe one of my last questions. What can people do? Like, what can people do? Like, what are some examples of maybe things that they can do? You mentioned the push ups, and maybe that's like the main thing. But like, what are other some things that they can actually like implement?
Do. Yeah.
Yeah.
What can you do? So push up is great. And imagine if you're that person with the tight pelvic floor muscles doing push-ups is potentially gonna make things worse, right? So
Right.
I am happy that the world is talking more about push-ups, Kegels, and even some doctors are suggesting them, but that only addresses one of the three things that your pelvic floor needs to do. So it needs
Okay.
to push up, do the contraction.
Mm-hmm.
It needs to relax back down to its baseline. And then it needs to be able to lengthen and stretch, just like every other muscle in your body. So a good way to do that is to do this like push like a pelvic floor breath, basically. So if you're just sitting or wherever you are, when you inhale, take a deep breath in, you're going to fill up your belly and your chest and your back, and you're also going to fill in your pelvic floor or your pelvic bowl. So if you're sitting on something, you would think about like putting pressure into the chair that you're sitting on with the pelvic floor, with your vulva. Okay, think of your butt bones widening, all of that as you inhale. You're the balloon, you're taking in air. And then you're going to exhale. You're going to close the labia, close the vaginal opening, and lift up like you're lifting a tampon or you're lifting the blueberry up the vagina. That's on the exhale. And so these muscles should be contracting. You should probably also feel your core contracting to help. And then you relax. So I know that was hard to do because I explained a lot. So let's do a couple of them. Inhale, expand everything, butt bones widen, open your holes, open your vagina hole, your butthole. Exhale, close and lift. Relax. Two more. Inhale, open the holes, open the sit bones, belly, chest. Exhale, close the sit bones, close the vagina, lift up through the vagina. Core is helping too. And then relax. Did I say one more? Let's do one. I don't remember. That's enough.
So that's really good because I feel like even like that connection with those muscles and being able to do that, right? Like I'm thinking like, oh wait, squeeze. Like I was just doing it with you, right? And I'm like, oh, squeeze, wait here, no, but relax here, no, breathe in, right? Like even just
The
practicing that,
coordination, yeah.
yeah, the coordination and just getting more like being able to control those muscle fibers and that mind muscle connection is really helpful. So I think we've kind of established, so the first step is knowing what's going on specifically with you and your muscles and getting that assessment.
Yeah.
So if people are in San Diego or the surrounding areas and want to come and work with you, what does that look like? How can they do that? And then for my virtual people who maybe aren't in the area, how can they still get more information from you or maybe still get some type of assessment? Yeah.
Yeah. So if you're here in San Diego, we're in Bankers Hill, right by Balboa Park. And I say we because there's two of us public physical therapists here, myself and Dr. Rowena. And our sessions are an hour long. You can just call or text us. You can even get in the slide into my DMs. Our whole team sees it though. So if you got like secrets, don't put any secrets in there. And you can also book yourself online too on stthrive.com is our website. Our
We'll put that
Instagram
in
is
the show notes too. So
perfect.
like
By
that.
Physical Therapy SD is our Instagram. Yeah, and you can just come straight in. You don't need a referral from your medical doctor. There
Love
are
that.
yeah, you don't need one. We can talk about like if you want insurance to reimburse and all this. And anyway, you don't have to. You can just come straight in. If you are not in the area, we can still work virtually. That does not look like we're not doing a like put your vulva up on the screen and I'm assessing it. That's not what a virtual assessment looks like. A virtual assessment and sessions are just a lot of education. and then watching you move on screen. If any of you have done like, virtual workouts too, like, you can get feedback. And as a PT, I can like see little sneaky things that you might be doing, that are inefficient. Or I can see you bear down or hear you bear down and kind of do something funky. So we can do that virtually. And then we also have, if you just want more information, we have a whole like webinar series called Muff and Stuff. Muff like pubic hair, also is the name of our dog. So you'll see her on there, but there's 4 modules. There's pelvic floor 101. There's one about like leaking and prolapse. There's one about diastasis recti, that like abdominal split. And then there's one about that good, so more about pleasure.
Yeah. Okay.
Yeah. And what else? That's all the things I think for now. If you're here in San Diego, we have some workshops and stuff coming up. So you can look at our Instagram for that.
And what is your Instagram?
Thrive Physical Therapy SD.
Love it. This is amazing. Thank you so much for sharing all this. Like you like blew my mind the last time we talked. So I'm like, I had to have you on the podcast to just talk all about it again. Thank you so much for sharing, and everyone else, go check out all the things she just mentioned and follow her on Instagram. And we will see you next week on the Create Your Shape podcast.